Hi there, I'm Dr. Aaron Tolson, one of the veterinarians here at Manchaca Village Veterinary Care. When I was younger, I thought being a vet meant playing with animals all day, which I do and I love it, but there's a lot more to it that I'd like to share with you. My day involves organization and reviewing medical records, examining pets and talking to their owners, as well as reviewing diagnostics such as imaging and blood work. All this together helps me to provide the highest quality medical care to my patients and to be able to wake up excited to come to work each day. The biggest part of being a veterinarian is being able to perform a thorough physical exam. Our patients can't tell us, or their owners, what is wrong. This is the time to be like a detective and search for medical clues to help you solve the case. Here I'm listening to the heart and lungs with my stethoscope. This is a crucial part of the exam, as you can often hear abnormalities well before the dog ever shows clinical signs. Now I'm examining the teeth, lymph nodes, and ears. Diseases of these areas are very common and often go unnoticed by their owners. If you notice the cheese on the table, this is our patient's version of a lollipop. You will frequently be cracking open a book to read about various conditions and the best way to treat them. You're never done learning as a doctor, so this is an integral part of the job. Not every case that comes in is simple and to the point, so this can literally be a lifesaver. Not to mention, you tend to look pretty cool with several medical textbooks sitting on your shelf. Back to being a detective, lab work gives you several clues that physical exam alone does not offer. Here I'm evaluating blood, urine, and fecal analysis to see how the body is functioning. Common conditions diagnosed with lab work are hormone disorders, urinary tract infections, and intestinal parasites. Ever wish you could have X-ray vision? Well, as a veterinarian, you can. X-rays help you to evaluate the bones as well as check for structural defects within the chest and abdomen. Additionally, ultrasound is another imaging modality available to help us make a diagnosis. Ultrasound allows you to evaluate things that X-rays won't show you, such as blood flow, architecture of organs, and much more. It takes a large amount of training and study to become a skilled ultrasonographer, but your patients will greatly benefit from it. Now for everybody's favorite, surgery. Surgery is physically repairing or removing damaged tissue. The most common procedures performed by a veterinarian are spays and neuters, but there is much more you can encounter on any given day. Here I'm repairing an ear hematoma. This is a collection of blood within the ear flap caused by trauma. Surgery can be very difficult or sometimes quite routine, but one thing is for certain, no 2 days of surgery are ever the same. As you can see, there's a lot that veterinarians do each day. It can be challenging at times, particularly because our patients can't talk to us, but the satisfaction of knowing you have helped animals in their time of need cannot be beat. And hey, when you get to work with cute dogs like Prince here, I think that's just about the best job in the world.